All right, so we're going to start the anatomy playlist. This one will go up toward the top, and we'll begin with the basics of anatomy. We start talking about anatomy and the different parts of your body. We're going to use a certain reference system, and there's a collection of terms that you'll need to know just at the very beginning, and the way that the body is referenced anatomically speaking. The word anatomy comes from the prefix ana, apart, and tomi, to cut. So anatomy is to cut apart, and that is referring to what they did a couple thousand years ago when they started to take the body apart and name the different parts, like musculae, muscle. As a Latin, it means something like little mouse, just because of the motion that the muscles would make under the skin. The Latins called that the musculae. They had things like cubit, which is the elbow, right? Because a cubit, like when Noah built the ark, it was something like 400 cubits by 800 cubits. Cubit is a length of measurement that runs from your elbow to your wrist. And sometimes that was called a foot, right? Like a foot long, because if you place your foot to your forearm, you'll find that your foot is from heel to toe as long as from your elbow to your wrist. That might be shocking to some people. Go ahead and try it now. But that's like a foot long or a cubit, and eventually we standardized those. But anatomy, when they started cutting apart and giving names to everything, they had to start with some basic terms, because not everyone knows what a cubit is, for instance. So we're going to have some basic terms, and anytime we talk about the body, and I use terms like anterior, posterior, superior, lateral, this is better than saying in front of or right next to or underneath, because those are subjective terms somewhat and can be confusing maybe when translated language to language. So we have a solid set of terms. It's going to start with, I have Logan zoom out a little bit. It's going to start with the body in what's called the anatomic position. So I'll be standing erect. My palms are facing forward, so my thumbs are facing out to the side or laterally. Both eyes are facing ahead and parallel. My toes, my feet are parallel, facing straight ahead, and I'm standing up like this. This is the anatomic position. Okay? So no matter how we're talking about the different parts, they're always referenced from this position, okay? The anatomic position. So when we talk about that, this way my fingers are always distal to my elbow. Distal means farther from the point of attachment. In this case, my upper limb attaches to my shoulder, so my fingers would be distal to my shoulder. And my fingers would be distal to my elbow. Even when my fingers are closer to my shoulder, right, strictly speaking, this would get confusing. Now they're proximal, now they're distal to the elbow. So we always refer back to that anatomic position. Okay? The next thing we're going to do is divide the body. This is my anatomic position guy. Right. The next thing we want to do is divide the body into 3 orthogonal planes. Okay. So 3 orthogonal planes. There's going to be one plane, if you can imagine these like a plane of glass, or sometimes people say like a guillotine blade that slides right down through this guy. Right? And this would divide him, chop that body right in half, right? So there's a back structure, right? So I've chopped him right from a front and a back part. We call this the frontal plane, right? Frontal plane. So it's a line of division. It doesn't have to be exactly in the middle. It could be further toward the front of my body, further toward the rear, but it's a frontal plane, and it's going to divide things into a front, in front of that plane, whatever it is, or behind that plane, wherever you've made that division of the body into a front and a back. When we make that frontal plane, everything in front of that frontal plane is going to be called anterior. And then everything behind that plane would be posterior. Right? You can look up the roots to these words later, like post meaning behind, and the IOR means pertaining to. So posterior means pertaining to, behind. Right? Anterior or anti, and then the suffix pertaining to, so pertaining to in the front, like the antechamber in a house, an anteroom, the ante bet in poker, ante meaning in front of. the antebellum South. That refers to a period of time before the Civil War, right? Ante in front of. So that's your frontal plane, and everything behind that plane is posterior and anterior. Those terms go together. Now, you don't always use that imaginary plane. Sometimes I will use that as a reference for another body part. Like in anatomic position, the tip of my nose is anterior to my ear. And then just flipping that word around, that automatically makes my ear posterior to the tip of my nose. So the words are always in reference to another anatomic part, and then they should be reversible. Okay? The next plane is going to be one that is a horizontal plane. Right? The horizontal plane cuts us in half and is going to divide us into anything below that plane or organ of reference or part of reference. Anything below that is going to be called inferior. Anything above that plane would be pertaining to above superior. So inferior and superior. Right? This is a horizontal plane. Horizontal is also called the transverse plane of division, and the frontal plane is sometimes called the coronal plane of division. I think horizontal and frontal are easier for non-anatomists to wrap their heads around and remember. Okay? So in this case, let's talk about how my feet are inferior to my hips, or my hips are inferior to my head. My head is superior to my heart. Right? In anatomic position, if we're talking about a plane that went right across, my fingers and hands would be inferior to the plane of my shoulders, although the limbs have a special set of reference terms that we'll talk about. The next plane is, because these are orthogonal, the next plane is going to cut our little anatomic dummy straight down the middle. And since it's orthogonal to that green plane and the red plane, you get these 3 degrees, front and back, up and down, and this one's going to divide us into a left and a right. Okay, so this plane is going to be called the sagittal plane. There's one mid-sagittal plane that's technically at the exact center of the human body. That's the mid-sagittal plane. And then any other sagittal planes next to this are going to be parasagittal planes. Okay, so we're going to skip mid and parallel to the mid. We'll just call this the sagittal plane. Right? Sagittal plane could divide things into left and right, but to make things a little easier, although whenever you use left and right, you're always referring to the body's left, the body's right. But we're going to say anything that's closer to the midline, anything moving closer to that midline, we're going to use the term medial. And anything moving away from that midline or further to the side, we'll say lateral. So in this case, okay, with my mid-sagittal line, or my sagittal line in that plane dividing me up, my ears would be lateral to my nose. My eyes are lateral, further out to the sides than my nose. My eyes would be medial, related to my ears, closer to the midline. Okay? So we get into the internal organs. Having the ability to describe an organ in its position front to back, up to down, and closer to the side or midline allows us in all 3 planes, or in the X, Y, and Z axis, to give you the coordinates right where you can find something like this, so to speak. We don't really give coordinates. Okay? Now there are a couple other special sets of terms, okay, that have to do with the limbs. Okay? So the arm and the leg, but not the 5th limb, not the head. Okay? So we're going to have 2 sets of terms that run along a limb. Any structure or reference that's closer to the point of attachment, that's going to be proximal. Okay? So closer to the point of attachment is proximal. And anything farther away is out in the distance, that's distal. So in this case, like I said earlier, my fingers are distal to my elbow. My elbow is proximal to my fingers. This is a basic set of terms, except for once we get interior, there's superficial, close to the surface, and then deep, which be organs that go successively deeper, like you're digging a hole. So superficial and deep are another set of terms to keep in mind. There are a few more, but these basic sets of terms will get you started with your anatomy. When you're watching these videos and I use these terms, you'll hear things like ventral, dorsal, caudal, rostral, but I'll explain those as we go. So don't forget to subscribe to the channel so you can check out more on the anatomy playlist, and then stay tuned for more.